Welcome to Mom in Mind. I'm your host, Dr. Kat. On our episode today, we are talking with Hannah Helms. She is going to be sharing with us what it's like to have a perinatal mood disorder while in a rural community. And there are a lot of people out there who have experienced this and know just how difficult it can be to find the help that you need, let alone being in a small community where other people know or might know what's going on for you and how to manage that. Hannah wants people to understand what it's like to live in a rural community. Like, what are the cultural norms? How do people interact? And what are the challenges that might be present for people who are living in rural areas who need treatment for a perinatal mood or anxiety disorder, especially when you're a helper who also needs help? Hannah shares with us her story through postpartum depression and postpartum anxiety after the birth of her third. Hannah is a mother of three, a spouse, and a trauma therapist who currently lives with her family in the Pacific Northwest. She experienced peri and postpartum anxiety following the birth of her third child in 2018. At the time, she was living and working in her hometown in Northern California and faced the unique challenge of trying to understand and seek treatment in a rural community. Let's meet Hannah. Welcome, Hannah. Thank you so much for being with us.
Yeah, thank you so much for having me, Dr. Kat.
Yes, I'm really grateful that you're coming on specifically to talk about what it's like to deal with perinatal mental health stuff in rural areas. And there are a lot of people who can identify with this, but really, I don't think there are a lot of places where they can hear somebody's experience that might resonate for them. So I'm glad you're talking about it and invite you to start wherever you'd like.
Yeah, absolutely. So yeah, dealing with perinatal mental health in a rural context was something I don't think that I ever even anticipated, right, until I was in the thick of it. And I know that some people um, go into maybe parenthood being able to anticipate that they're going to need to be extra tuned into their mental health. But for me, um, that was not something that was on my radar. So I was raised in a rural community in Northern California, a town population about 3,500 people um, in Siskiyou County. So you know, lots of space, few people. So um I the town I was in was along the Interstate 5 corridor for people who are familiar with California. So I think I with kind of within the spectrum of being rural, I was in a place that had more access. I was in one of the towns that had one of the county's two critical access hospitals. I was also employed there. And I think for me, my experience with kind of mental health in the aftermath of having kids was something that was really progressive. I had my first daughter in 2014 and really went into parenthood. My spouse and I really went in with this idea of trying to have a very equitable parenting dynamic. I think we really anticipated that things would be challenging jumping from being single to having kids. And so um it was it was pretty okay. I had some struggles with breastfeeding and whatnot, and then it wasn't until my second child was born. I got pregnant when my oldest was 6 months old. So my
Mm.
two oldest kiddos are 15 and a half months apart, which is close.
Yeah, it is very close.
It's great now. It's great now because they're 7 and 8 and they're buddies, but
Mhm.
holy moly. I feel like after my second was born in the spring of 2015, that's when things got really hard. And I was so angry.
Mm.
Like I didn't even realize, I don't think it was until even later after the birth of my third when I started listening to your podcast.
Mm.
Um, I think there was, I don't remember if it was a section or a whole episode on postpartum rage. And
Mhm.
it was like this light bulb went off and it's like, oh, that was postpartum mental health, right? It was this hindsight
Yeah.
thing. And so I, at the time, I didn't really know what to make of it. My husband was working outside of the home. I was on maternity leave, and I was being like this human jungle gym for
Mm.
this toddler with like this newborn. And I remember one day like sitting with my youngest child in my lap while my older one, Olivia, was just like climbing on top of me, and I was eating directly out of like a half-gallon container of ice cream, like just
Right.
on the floor of my kid's bedroom, and calling my husband and being like, when are you coming home? When are you coming home?
Yeah.
I'm so mad. I'm just
Mm.
so angry and so mad. And like, I feel like everything is setting me off.
Yeah.
Um, and then that that eventually subsided a little bit. I did attempt to get counseling, but the person that I went to go see, I think had no clue at
Mm.
all um, about postpartum mental health. And I
Right.
went in, and I think they looked at me and they're like, so you feel like you have anger issues, um, but coping strategies.
Mm.
So we just it was so awkward. It was just
Oh,
awkward. It was
yeah.
like, um, so this person, I think very much this professional really wanted to help, but just was not, because their training hadn't necessarily included
Hmm.
perinatal mental health. They weren't connecting those dots.
Right.
Yeah. And so then um things did start to get better. Like that started to lift after a while. I think after we got out of once my second child was a year old.
Mm.
Um and
So
then
that whole time, essentially after the birth, you were in this phase of some level of
I
suffering.
was like angry. Yeah, I was just angry and irritable. And I remember talking to my primary care provider about it. We had a family practice doc. And he was very sympathetic and compassionate, but again, was not connecting the dots. It was like,
Right.
well, you have two young children. Like it makes sense that you feel that, like very validating, but
Mm.
also
Hmm.
um beyond. I needed more than validation,
Right.
and I
Yeah.
think, I mean, validation is so wonderful to feel like we're not like crazy, like we're not
Hmm.
just making it up, right? But
Hmm.
at the same time, like I think it has to, like, it's but wait, there's more. Like there has to be
Yeah.
more. And
Yes.
I wasn't getting that. And so um things really didn't, I think, devolve for me until um my pregnancy and then the birth of my third child. So um I in 2016 I started an MSW program, um and then got pregnant in the middle of that,
That's tough.
which is fantastic timing. I
Right.
mean, I'm sure there's many of
Mhm.
the people listening to this have juggled like pregnancy and parenthood and school and all of
Mhm.
that. And so I was on track to graduate at the end of 2017, and I was due January of 2018.
Mm.
Um, and I was working. So in addition to doing my master's in social work, I was also working and had been working for a while,
Mhm.
um, doing medical social work at the critical access hospital, which in
Mhm.
rural communities you can do with a bachelor's in social work degree.
Oh,
I know that's, yeah.
I didn't know
If you
that.
have, yeah, for certain program, I was working.
Mhm.
So I was working in hospice primarily.
Oh,
So
okay. Yeah.
there's exceptions within hospice to increase equitable access,
Yeah.
that allows for that. So with of course clinical oversight
Mhm.
of an MSW. So um, that's what I was doing. So I was working, doing end of life social work, um, and then getting my master's. And because of the personality that I am, I decided to do it as quickly as I humanly could.
Uh-huh.
So I was taking a full course load,
Oh, that's so much.
which in hindsight was a bad decision. Like objectively,
Mhm.
this was not a wise decision. Um, and then doing practicum, doing community organizing. So
Wow.
I did kind of more like education
Mhm.
for the community. and like a lot of, yeah, organizing. And so, and then in the midst of that, there was a pretty significant um, community tragedy. And for people listening to this who have lived in rural communities, um, I think things that feel like headlines. I live in a city in the Pacific Northwest now, but when like major headlines like are so personal when you're
Right.
living in a rural community. And so there was a
Sure.
pretty tragic um homicide suicide case, and because of my position, I ended up doing a lot of grief support.
Uh-huh.
Um and it was just a lot. And I started having really bad anxiety,
Mm-hmm.
like really bad anxiety, um, to the point of like having panic attacks
Mm-hmm.
before I even had baby. Um, and
Oh, and sorry,
also
what's the spacing of their second and third?
my second and third, so they are 2.5 years apart.
Mm-hmm.
And between baby one and baby three, 4 years and 2 days.
Okay. Oh,
Yeah.
wow.
And so for context,
Yeah, yeah.
also
Mm-hmm.
very much the norm in like a rural community. And like I
Mm-hmm.
grew up in like a young Catholic family. So like my siblings and I
Mm-hmm.
are all a year apart in age.
Mm-hmm.
Like one my
Mm-hmm.
bless my mother, she was pregnant for 4 years straight, essentially. And
Oh,
so that
sure.
was like, even though I waited until I was older, I waited and until I was late 20s to even start having kids. Which again, everybody else was done having kids by their late 20s in a
Uh-huh.
rural community. So um that was kind of not, expectation feels like a really strong word. That was celebrated.
Mm,
Like
for
that
sure.
was,
Yeah.
yeah, that was like people were really excited. And then,
Mm-hmm.
whenever I'd get together with friends, we'd just have like a herd of small children running
Right.
around
Yeah. Right. Right.
constantly.
Yeah.
Um
So, just again, just for
yeah.
my understanding, the you had been having a hard time after baby number two, and
Yes.
it did it get better before you were pregnant, or were you going into pregnancy still trying to cope
Mm.
with what you were going
That's a great question. I think it subsided.
through? Mm-hmm.
Um, I also think that because of the type of person that I am, giving myself so many things to do served as distraction, or
Mm-hmm.
or you know or avoid, or it was
Sure.
coping,
Stay
like,
busy. Mm-hmm.
yeah, stay busy. I mean, avoidance is a fantastic coping strategy until it's not.
Till it's not.
Until it's
Correct.
not.
Yes.
Um and so um that level, like the level of, I think, irritability, anger, frustration, had subsided, mostly because my attention was elsewhere. I don't think it was ever actually dealt
Mm-hmm.
with. And so it was like it had been put on the back burner. And then I was in this very busy stage of life. And um I think this dynamic that happens in many places, and especially rural communities, is it seems like people who are in positions of being helpers, or in like a human service oriented line of work, or people who maybe are just kind of naturally compassionate, or who tend to extend themselves, end up doing a lot of different things. And
Mm-hmm.
that was, I don't know if that's something that listeners can relate to, but in the community I was in, it seemed like I was in meetings for a lot of different things,
Mm-hmm.
but it was just kind of like a shuffling of the same groups of people.
Oh, right, right, right.
So in my time in a rural community, I did anti-trafficking work. I did community education around like um, evidence-based approaches to homelessness, and uh, prevention education and things like that. And it was generally the same.
Mm.
group of folks just
Mhm.
talking about a different thing.
Right.
Um,
Right.
and so I think that dynamic and that expectation
Mhm.
um, was really challenging
Yeah.
for me.
Yeah, for sure. I mean that's a lot to hold while you're very,
Hmm.
very busy and have kids and I think just for most people switching between like being the nurturer at home
Hmm.
and giving that like close attention and having your heart more open and then going into the kind of work you're describing where it's like really can be really
Hmm.
intense. That's a
Yeah.
lot of switching around you have to do and
Right.
sometimes you can leave yourself a little bit more open in places where you're trying to not
Hmm.
take as much on.
Absolutely. And I think the other challenge of that is um I think in rural communities, because of the number of dual relationships that just exist,
Mm-hmm.
um, and I think that was one of the biggest challenges of being in the role of social work, of being a helper, is really trying to have strong professional boundaries, but it being nearly impossible
Mm-hmm.
because, if I'm running out to the store and running errands and I have like a screaming toddler with me, I'm inevitably going to run into someone
Mm-hmm.
from work who's been a client or who was a patient
Oh,
that I was
sure.
caring for. And so um, I think that is also a really significant challenge in rural places.
Mm-hmm.
And I think it happens in a professional context, but it also happens, I think, for people who maybe aren't working as, maybe a nurse or a doctor or a teacher
Mm-hmm.
or a social
Mm-hmm.
worker, where you just um it's a blessing and a curse in some
Mm-hmm.
ways, right? Like there's on the one hand, people know you and they see you, and yet also if you want to maybe kind of have some confidentiality or privacy or to be vulnerable with a certain set of people, that doesn't you're in a fishbowl. It's really hard to
Right.
have that. Um yeah.
So I had sort of cut you off a little bit to ask about more of this context,
Hmm.
but where I had is where we left off before is where you were starting to experience
Mm,
panic attacks, and
yeah.
right. So back to your internal experience, what was
Yeah,
going on?
absolutely. So really started to experience a lot of kind of panic attacks. Like anytime I would leave my house or a place that would feel safe.
Mm,
Um, doing community based work at the time, which is what I was doing. And I had planned to work up until about like 3 weeks before my due date.
mm-hmm,
Um, I was doing home visits. And so it's really hard to like do my job if I'm like sitting white knuckled in the driveway of a hospice patient's house, like, you know, trying to like, do my grounding exercises of like, oh,
mm-hmm,
what are 5 things I can see? What are, like,
mm-hmm. Yeah, right.
really trying to ground myself and get through um a home visit. And kind of the kicker, like the thing that really sent it over the edge. I remember this. And I think it's important to share this because I think sometimes like I know that a lot of professionals listen to your podcast and like I think we all have like our professional like horror stories, right? Of
Mm-hmm,
like the worst thing that happened to me.
mm-hmm.
I had a panic attack at a patient's house
Oh,
and I knew this patient. I knew their family. I had
mm-hmm.
been part of the hospice team for multiple family members. And I had driven there in my own car, and my patient's wife drove me home, like to my house.
Wow.
And it was one of those moments, I think, and I'm getting teared up now. And I think it's like uh, it's not embarrassment, it's not shame. I think it's really like there's this self-compassion, I think,
Mm-hmm,
that I feel now of like,
mm-hmm.
oh man,
Right,
I
right.
really had to minimize so much to just survive. And then in hindsight, when I think about it, it's like, oh, it was really severe.
Mm-hmm,
Like this was some really, really severe
mm-hmm.
anxiety. And in hindsight, I'm also so glad that it was that patient and that
Oh,
patient's spouse. And because I grew up in a rural community, they knew my family. They,
Oh,
like, knew my parents. That's the
yeah.
thing. There's no, like that's the first thing. Like,
Mhm.
"Are you from here?" Like,
Right.
"Who are your parents?" And
Mhm.
then, like, I fortunately, like, my parents are very well loved in my hometown, so it's like, "Oh, you're Mike and Janie's kid. You're fine. You can come here. Yeah, ask me all these personal questions. No, I haven't done
Oh.
my will." Like,
Oh, interesting.
yeah. So, and I'm sure that some people working in rural communities can relate. Like,
Mhm.
there's
Mhm.
this very much in group, out group dynamic of
Mhm.
like, you're nobody cared what education I had or what degree
Mhm.
I had. People cared that I was from Siskiyou County.
Mhm.
That was my credibility.
Sure.
And so um I survived having a panic attack at a patient's house and having them drive me home in my own car. So like
Yeah.
and that also was this turning point for me where I really realized like, oh, I need to I need to go on pregnancy disability
Mhm.
leave now,
Mhm.
which is a
Mhm.
wonderful thing that we have in California where I was living at the time. Um, but even with that, it still took a long time for me to be able to kind of get to the place where I was able to accept help. I Another challenge that I had is I did want some level of anonymity.
Mhm.
And
Right.
because I was often collaborating with other mental health providers in my community, I didn't want to like go to somebody I was referring my
Right.
clients to. And this was pre-pandemic. So telehealth was not as ubiquitous as it is
Oh,
now. It
right.
wasn't as accessible. And people were really it was really challenging to make that happen. I did attempt to see um one clinician um before Nora, my youngest, was born,
Mm.
and it did not go well. I was not familiar with this provider
Mhm.
because I had not been referring to them, so I was like that gave me a small level of comfort.
Yeah.
And
Right.
based on the information that was available on their website, I was like, okay, this seems like this person seems like someone who's approach to therapy is something I feel comfortable with.
Mhm.
It doesn't say anything specifically about perinatal mood or anxiety disorders, but
Did you know that was a thing at that point?
I knew like postpartum mental health was a thing,
Mhm. Mhm.
but beyond that, I didn't know like therapeutic approaches that would be most appropriate. I knew like maybe it was more like this person seems like they have a lot of knowledge in these other areas.
Mhm.
Perhaps they can help. And
Right.
it was not a successful session. Again, just like that experience after my second was born, this person really was not connecting
Mhm.
kind of the severity of what I was experiencing. I had a panic attack in their waiting room.
Oh.
Um, and they this was not something that was like readily available, but when I sat down for my initial intake with them, they spent a solid 15 minutes talking about how they did not believe in the efficacy of medication to treat mental health and that
Mm.
they would not support me pursuing that if that was something that I wanted to do. And
Wow.
I know, I know. And I
Wow.
know meds are not a good fit for everybody,
Sure.
but they ended up being life-saving for me. So,
Mhm.
um, that was not a good fit. So
Mhm.
I
And
didn't see
right.
that person again at all.
Right. So you have a really limited availability.
Limited availability and even with the providers that were available, the knowledge was not there.
Mm.
Um, and so what I ended up doing is and then to compound it all, I had a
Mhm.
fairly traumatic birthing experience with
Oh.
my third. I know. And so which it was like labor and delivery was fine. I am one of those unfortunate people who just has a heck of a time like with kind of that final stage of labor and delivery. So
Mm.
I was not able to deliver my placenta at all and had to have that like
Mm.
surgically removed right after baby was born, which also happened with my first.
Oh,
So,
okay.
yeah. So, yeah, 0 stars. Do not recommend that experience.
Right. Right.
um and so I finally what I ended up doing is I I got to a place where was seeing I was seeing my primary care provider like once a week just
Mhm.
because I was like, I don't know what to do. I'm miserable. I'm having
Mhm.
panic attacks. I don't know what to do about this.
This
And they
is
were,
after this
this
isn't
is after
postpartum.
baby was born.
Uh-huh,
This is
okay.
postpartum. I was having like weekly visits because what else was there?
Right.
Um, I did reach out to a family friend who was an LMFT in the Bay Area and just texted them and I said, do you have anybody who you would recommend who knows something about postpartum mental health who would also be willing to see me remotely? I've got
Mhm.
nobody.
Mhm.
Like there's nobody with expertise here. And she was able to give me the name of a friend who like was out of network and we just used like so was out of network for us, but because of the timing, we just used like our tax return and paid out
Mhm.
of pocket for
Mhm.
therapy.
Mhm.
And um, so I would just remember like I would sit like cross-legged, like had my baby in my arms who um I think all the stereotypes that people have about youngest children are true of this child, and I think in part, some of what contributed to that was the level of anxiety that I was
Mhm.
having because,
Mhm.
um, I, like, could not put her down,
Right.
and if she cried,
Mhm.
it was this enormous like, the level of, like, feeling triggered, feeling like
Yeah.
that internal fight or flight response
Mhm.
was so intense, I could not endure it, and then I was still super irritable and angry,
Yeah.
and I think I realize this is a little jumbled, but in honest like, to be honest, like, this feels very foggy and out of order, like, the memories from this time,
Oh,
but
yeah.
there were a few things. I remember at one point, what really kicked me into gear to reaching out and starting to see a therapist was, um, my husband. I got really mad at him and lashed out at him, and he said, I feel like I'm on eggshells. Like, you
Mhm.
tell me that you want help, but you won't let me hold the
Mhm.
baby.
Mhm.
Like,
Mhm. Mhm.
you say that you're doing this all by yourself, but you won't let anyone help, and I don't know what to do. I don't know how I can help you and how I can support you at this point in time, and I want to,
Mhm.
but I can't because you won't let me. And so that was a pretty significant shift. So
Yeah.
I ended up seeing this therapist remotely. And so I would just like sit in my bed, like on Zoom.
Mhm. Mhm.
Um, and she was so gracious. I think she was very much able to see like what a mess I was at the time and how much I needed. And I think she did a really great job of striking this balance between clearly communicating what she saw as needs, but also not pushing me to the point of resistance. And
Right.
so
Right.
we had a lot of conversation about medication and whether or not that would be useful for me. Um, I signed a release of information so she could talk to my primary care doc.
Mhm.
Um, and she just really was willing to like explore my resistance to that. And I think that was one of those hallmarks of being in a rural community is
Mhm.
kind of this cultural value of like being fiercely independent,
Right.
an inherent distrust of systems,
Mhm.
like of the government, of
Mhm.
tradition. Like my family of origin, like I think I was like the first person. My mom is like one of 8 kids, like I said,
Mhm.
like big
Mhm.
Catholic
Mhm.
family, right? So like I think I may have been the first person in my entire family to like go on antidepressant medication.
Mhm.
Um,
Right.
and there was just like this idea of like, no, like you just pull yourself up
Yeah.
by your bootstraps,
Yeah.
by your mental health bootstraps. And then it's like, well, that's great, but I can't even find my boots.
Right.
So like,
Right.
it's not gonna
Right.
work.
Right.
So I had this provider. And then one day I was scheduled to see my primary care doc and he was not available.
Mhm.
But the family nurse practitioner who he worked with was available, and so she filled in. And that conversation with her was really monumental in shifting my perspective on starting to take medication. And
Mm.
she passed away just earlier this year, but she was
Oh, no.
like, and I never got to tell her thank you for this wonderful thing that she said. It was like she probably didn't even remember it, but it was just this little tidbit. And I remember sitting and I would just like get in the room and I would just start bawling.
Right.
And she just like looked at me with compassion, not pity, like a
Mm-hmm.
genuine compassion. And she said,
Yeah.
there are so many things to fight for and fight through as a mom.
Mm-hmm.
This doesn't have to be one of them. Like
Mm-hmm.
you could take medication and it would be okay
Mm-hmm.
because then you might actually be able to fight through the other stuff.
Mm-hmm.
And just that mental shift was so profound.
Yeah.
And so I really wanted to keep nursing. And so I ended up low dose Zoloft. Um and then gradually, very gradually upped that. And that was so helpful.
Mm-hmm.
Um
It is
and
that like
yeah.
that experience of I think it's particularly difficult in my experience anyways,
Mhm.
like on, uh, both as being a therapist and having gone through it myself too, is anxiety is part of the reason it's hard to
Yeah.
take medication or
Mhm.
to accept that that could be
Mhm.
possible. It's so hard to get past that point
Yeah.
of the whatever the resistance
Mhm.
as you uh, called it, but it's also because of the nature of anxiety having to do with fear and fear of the
Mhm.
unknown, and doing
Yeah.
something new, taking something new. It's just it gets wrapped up right into the
Mhm.
anxiety as well. It
Yeah.
creates a massive barrier, and
Yeah.
sometimes prolongs, well, often prolongs people feeling better.
Yeah. Yeah. So yeah, and I think that's exactly what it was. It was all those what ifs.
Mm-hmm.
And I think finally being able to verbalize those out loud and hear myself actually acknowledge what those what ifs were. And then to be able to have a dialogue and say, just because I'm saying yes now doesn't mean I'm saying yes forever. And I think that's
Right,
something
right,
that
right.
I had forgotten.
Yeah.
And um I think
As a helper, you
as
had,
a helper, right?
yeah,
Like
you
just
had
be
forgotten that.
and like all these things that it's so easy
Hmm.
for me to say to someone else.
For
But
sure, right.
like I sometimes we're really bad at like
Hmm.
doing the things we know are the right things to do as
Hmm.
helpers. And um I think too, and another piece of it was um I had probably so much internalized bias myself
Mm-hmm.
um around mental health. And I think that was very much something that I had to work through. And I think sometimes it's easy to forget, that just because I'm in this in a capacity as a professional, that doesn't mean that I've completely worked through those maybe unacknowledged biases that I still hold on to.
Yeah.
And that was a huge component of it. And so
Was
yeah.
part of that like from family culture or
Mhm.
rural community culture
I
as
think
well?
so. I think family culture, I think part of it too was at the time, I think I had mentioned, my family was um, you know, big kind of boisterous Catholic family.
Mm.
But for a very long time I was very involved in kind of a more non-denominational or like evangelical faith based kind of practice,
Mm-hmm.
and have since kind of left that and exited that. But there's very much, I think, a value in that, and this idea that um you know that if you have kind of a vibrant living faith, mental health should not be an issue.
Mm.
So it's kind of that spiritual bypassing, I think, that happens of like, oh, well, just maybe you should have more faith, or maybe you should pray
Mm-hmm.
about it more, or
Mm-hmm.
maybe if you were better at this
Ooh.
I know, right? Like,
Yes. Yes.
but
That's
but I
loaded.
think I think it's worth saying though, because I'm
Mhm.
I'm I'm imagining people are going to listen to this, especially people in rural communities,
Mhm.
and there's this idea that if we it's almost that magical thinking of like if we just believe, we can be fine.
Right.
And it's a personal failing of some sort if I'm not able to have enough faith. And so I think that belief system really influenced my resistance to medication.
Mhm.
But I don't think we would ever look at someone living with diabetes and say, like, well, have you just like tried? Like, have you just tried to make more insulin?
Right.
Maybe if you believed
100%.
more, like you would have more insulin and then this wouldn't be an issue for you. But like,
Right.
that would be an awful and ridiculous thing to say to someone.
Mhm.
But for some reason, in particular, I think in certain communities, right, like politics and faith are really linked. So, um, there's all of these different factors that influence like the way that we perceive the world and our belief systems. And for the environment that I was kind of like marinating in, I think all of those things came together and really contributed to my resistance at the
Mhm.
time.
Mhm.
Um, and I, in hindsight, am like, oh, I probably am the type of person who like has always really struggled with mental health. And like maybe it would have been great if I had started taking meds in my early 20s instead of now.
Got it.
That
Yeah, isn't that that's so hard too, to realize these things and
yeah,
look back and see how hard life
yeah,
had been, and maybe
yeah,
that it didn't have to be quite that hard.
yeah,
Um,
absolutely.
yeah.
And I think that that really has been something that has been present in like the aftermath of all of this is that
Mhm.
grief of like, oh, if I had only known.
Mhm.
Like, if I had been able to have fair and realistic expectations for myself,
Mhm.
um, and right after I went back to work, after my 3rd was born, the hospital system that I was working for started this really big push on maternal mental health,
But
and I know.
wow.
Oh,
What,
yeah, and
well, how long ago was that?
like,
It,
I don't know, mid 2018, 2019, but
okay.
there was
Right.
this really big push to,
Mhm.
like, screen, and
Yep.
it's like there's a lot of emphasis on screening, and
Mhm.
like I also was working on the initiative to like screen for human trafficking, and screening is great, but it does diddly squat if you don't have anything to offer after you're
Right.
done screening people.
So
And
true.
so um I learned so much about PMADS, perinatal mood and anxiety disorders, after I came back from maternity leave, and it was like light bulb after light bulb after
Mm.
light bulb.
Mhm.
And
Was
also,
was the hospital offering training, or you got,
mhm,
oh, okay,
yeah,
good.
so um we did a lot of training, so there was time for that, and because I was part of this, there was like 2 of us. It's a critical access hospital, so there's
Mhm.
like 2 social workers for the whole hospital. So the 2
Mhm.
of us
Okay.
got to go and do these trainings. We got trained in there's an East Coast based model of group peer support,
Mhm.
GPS. So I got
Yep.
trained in GPS facilitation,
Nice.
did a couple of trainings on, I forget, is it Peg Inman? Maybe there
Peck.
were Peck,
Mhm.
not Peg, Peck. So I went to a training that was
Mhm.
co-sponsored through the healthcare system and county
Mhm.
behavioral health by
Mhm.
Peck,
Mhm.
and just was sitting there getting all of this information. And again, feeling like, oh, this is so great to know. And then also really pissed off that I didn't know
Yeah,
this ahead of time.
I know, right?
And then I think the other component too is I think just knowing would have helped, because then I would not have been sitting there thinking, what is wrong with
Mhm.
me? Like
Mhm.
I am like I should be able to like do that, just shooting all over myself.
Right. Yep,
Um
yep, yep.
and so I think normalizing, like just communicating like that this is normal and
Mhm.
this is very much a part of what the normal like transition to parenthood can look like for you know everybody, like not just moms but also dads
Mhm.
and
Mhm.
um you know everybody, not and like non-binary parents and trans parents, and like this hits across the board for everybody. And I think, looking at it now in hindsight, like what could that have changed in like living in this rural area? And I think
Mhm.
I think eliminating that stigma and that resistance to help, I think having had the opportunity to like be a better self advocate,
Right.
um, being able to say to my doctor, like, hey, I'm pretty sure you can do like psychiatric consultation through
Mhm.
um, Postpartum Support International, just knowing what was available. Um, and then also being able to like have that peer support component, because I think
Yeah.
so often, because there is an emphasis on like being strong, being independent, being capable, and um, you know, being okay. That comes not, I don't think that's exclusive to rural communities, but I think that is magnified in rural communities.
Right. Like you're one of one.
Yeah.
Or it
Yeah.
can feel like nobody else is dealing with this. Well, certainly at that time, nobody or not many
Mm-mm.
people knew that this was even a thing.
Right. And it hasn't been until now, after the fact, as I communicate to like friends who I was having kids with at the time, it's like, oh,
Mhm.
cool. We were just like suffering in silence down
Oh
the street from each
man,
other.
all of like
Super
with the
great.
herd.
Yeah. Yeah. Just like, you
Hmm.
know, um, and I think had the idea that this is going to be normal, and like it's probably smart to just check in with people, when you're
Right.
signing up for the meal train, like you get meal train requests like
Hmm.
every week. To just be able to like connect with people and say like, how are you really doing? Like, do
Hmm.
you need me to like, be a sounding board? Like, just kind of, I think because peer support can be so helpful, really eliminating the barriers to that could have been useful.
Sure. So, in terms of this information coming to your rural community, you getting training, and other people too.
Mm-hmm.
There were,
Yeah. So, because
yeah.
a lot of partnership was done both between the hospital I was working at and the county, a lot of people who were working in local nonprofits, people
Hmm.
who were rooted at the various family resource centers. Um, and I think it would be really interesting to see now what the shift has been
Hmm.
with kind of the increased availability of telemental health, because I imagine that that
Oh
has
yeah,
also really contributed as well.
yeah, for
Um,
sure. Like changing the community
mhm.
for the better.
Yes, yeah, making it more accessible. Um, yeah, I I think, and this is like in reference to something I said earlier, like I feel like there's different levels, right? Like there's the ability to recognize and screen someone
Hmm.
for for perinatal mental health needs, but then there's the added step of like, so then what next? Like
Hmm.
then what do we do to actually treat that and help people with that? Um, and so I think, you know, the things like making education more accessible, whether it be for primary care docs and how to intervene and what they can
Hmm.
do for their clients, making education more accessible for people who are providing mental health care in rural
Yeah.
communities.
Right.
Um, and then,
Yeah.
oh, go for it. Yeah.
Well, yeah, I was there's this difficulty I find between let me put it this way. So now that you know how important it is,
Hmm.
and that feeling of man, it would have been nice to know before I went through all of this. Some of the challenge I find is that in some ways people either don't want to know
Hmm.
about like this kind of stuff because it's postpartum mental health, that's like, oh, that's not going to happen to me, so I'm not
Hmm.
going to bother
Yeah.
like learning about it. um as well as whatever stigma there is around mental health, anyways. And then all of these other layers that you're describing, specifically in rural community, um, about pulling yourself up by your bootstraps. If you, I think from what you're saying, if you sort of say something about how you're doing, then people are going to know.
Oh, yeah.
I don't know how fast news travels, but it sounds like it could travel
Yeah.
fast. So there's a lot of like
Mhm.
nobody nobody wants to be embarrassed
Mhm.
or be talked about or judged or
Yeah.
anything like that. So I just find that one of the barriers is, how do you convince people in a rural community
Mhm.
that knowing about this is important?
Yeah.
Not that you I'm asking you
Yeah.
to answer that
Yeah.
question. It's just a question, to
Yeah.
ponder.
I think I think that's a really tough one. I think, um, some things that come to mind are really trying to tie it into the overall, like, value of, like, the value system that exists that really holds, like, the idea of a family unit in high
Mm-hmm.
esteem and,
Mm-hmm.
like,
Mm-hmm.
parenthood in high
Mm-hmm.
esteem, and so really putting it in terms of, you know, just because you haven't been talking about this doesn't mean it's not happening. We know it is. Like,
Right.
we know it
Right.
is. And why would we not want the people in our communities who are parenting kids, who are raising up the next generation to be in the best position to do so?
Mm-hmm.
Um, and so my thought is really aligning it to those pre-existing rural values. And as much as there is this emphasis and value on kind of independence
Mm-hmm.
and um, self-efficacy and being able to do things without having to rely on other people, there's also seemingly in conflict, but very much this very real idea of like we take care of each other, like we show up for one another.
Mm-hmm.
If
Mm-hmm.
you need me to drive my backhoe to your backyard so you can dig a big old hole, I'll do it. And
Mm-hmm.
we've had people do that. Like,
Sure.
no,
Right.
oh my gosh, you need to borrow this. Like, you can absolutely have it. Oh, you need help with
Mm-hmm.
so and so. Like, um,
That sounds like more one of the gifts of a smaller rural community
absolutely.
that just doesn't happen in big suburbia or as
No,
much. Um,
no. I think the closest I've gotten to that is I'm part of a local like buy nothing group on Facebook, and
mm-hmm.
um, it feels like home. It's great. Like, I
Mm-hmm.
borrowed someone's like food meal the other day, and it was like, oh, this is just like being at home. Um, but yeah, you're right. Like, and so I think it is harnessing that and
Mm-hmm.
taking it and building on it, because I think in a lot of ways that shows up as like, here, I will share my material possession with you, or I will give you the gift of time. And I think leveraging that and saying we need more authentic community. We need that kind of ability to show up and
Mm-hmm.
help one another,
Mm-hmm.
plus this layer of like vulnerability.
Yeah, sure.
Um and I think the other thing is like someone has to go first, right? Like, in a
Mm-hmm.
lot of
Mm-hmm.
communities, like someone has to go first and like break
Yep.
that taboo of like, oh, we're gonna walk around this elephant in the room. And I think
Yeah.
someone has to have the courage to say, like, actually, no, this really sucks. Like,
Uh-huh.
I
Mm-hmm.
motherhood and parenthood is not the gift that I thought it would be.
Right.
Or you know, uh and that's really tough to
Mm-hmm.
do, and it
Mm-hmm.
takes a tremendous amount of courage,
Mm-hmm.
but it's also necessary.
For sure.
I think one of the things that I've been acknowledging and leveraging, like, informal supports. I think
Mm-hmm.
immediately getting that kind of really what was intensive education following my experience, there was this idea of like, "Oh, I need to find someone who is certified and, like, professional to help me," and I think, yes, like, I needed someone who was knowledgeable about mental health and perinatal mental health, and I think we could mitigate the need for a lot of I think we could mitigate the severity of a lot of maternal mental health in rural communities if we really leveraged those informal and pre-existing support networks. Because that's what happened. Like, that is really the key type of support is it's not always something that I'm thinking back to my own experience as, like, a social worker, and a lot of times the resources I was connecting people to help them out were not like these were not agencies. They weren't like these formal individuals. It was like, "Oh, Betty from the church is gonna set up a meal train when you get
Mm-hmm.
home from having your surgery,
Mm-hmm.
and then, Dan from down the street is gonna take over all your yard work, and, oh,
Mm-hmm.
yep, Dan called me and told me he's actually gonna it's really looking at what the culture is and what feels comfortable and augmenting and building upon that.
Mm-hmm.
And so, because I think one of the things that can happen is, um, and one of the things that happened for me was there is this idea of like, oh no, it's hopeless. There's nobody here. Like
Right.
there's no
Right. Right.
clinicians here who are trained. Like I cannot possibly get the level of service that I need because there's nobody here with the intensive training and qualification. And so I think knowing like we can get really creative.
Mm-hmm.
You can have, your kids play group. Those moms are gonna like come take your toddler, um, so you can actually get some sleep because
Mm-hmm.
dear God, you need sleep.
Right.
And and you're gonna like hop on this virtual support group that's based on the East Coast, but the time works out because you can do it because you're
Mm-hmm.
up at 6 a.m. with the
Mm-hmm.
colicky baby anyway. It
Mm-hmm.
just I think really the creative and flexibility and ingenuity that's inherent to rural communities can also be an asset. And I think
Yeah. Yeah.
holding those two things at the same time, right? We do need more people who are very knowledgeable and trained and certified in meeting these needs. And just because those things aren't there doesn't mean that there aren't already these
Mm-hmm.
entities that can help mitigate the risks that come with having kids. So, and maternal health. So,
Fantastic.
yeah.
So through all of your experience, you've learned so much and you've gone through so much. What was the turning point for you? Like how did you get better?
Yeah, I think let's see. I think things really started to improve um with probably about a year and a half postpartum. I think things started to get better. I think some things that helped that I just made peace with the fact that my youngest child was going to like co-sleep with us forever. And so just and I realize co-sleeping can be a hot topic for people, but for us and for like my ability to like not be a panicky, anxious, hot mess and to like
Mhm.
also get sleep, right? Because like
Mhm.
I needed sleep.
Yeah.
I mean, did I install a toddler rail on our king size bed? Yes, I did. And
Mhm.
like we just lived with that.
Mhm.
Um, I eventually weaned my oldest kiddo and switched to a different med. Like Zoloft was great, but it was not as it didn't have the oomph that I needed.
Mhm.
And so yeah, I had great success with Lexapro and still am on that today and like it makes a world of difference. Um I honestly think that getting education and training and just kind of getting more knowledge, like having more knowledge about
Mhm.
everything really created this level of perspective that I did not previously have. It helped
Mhm.
me be a lot kinder to
Yeah,
myself,
for sure.
um,
Yep.
and helped me lower some expectations. And then I think the other thing that I really realized is for me, doing the work that I was doing in a rural community was not sustainable.
Mhm.
And for me, the tension between having to be in this capacity as a helper and kind of always
Mhm.
being in like this fishbowl and
Mhm.
not really having the space to be um vulnerable um or to not have parts like I just like sometimes you just want to like go get a pint of Ben and Jerry's at 11 p.m. and with a sweatshirt and not have to wear a
Right.
bra. And like, I could not do that. You know, like
Uh-huh.
I just want to like run out and like be able to like
Mhm.
not worry about running into someone who is gonna talk to me. And part of that's also because I'm an introvert. But not to say, I don't think the issue in and of that was the rural community itself. I think it was my chosen profession in a
Mm,
rural community. And so for us, rather than switching to a different line of work, um, and based on some other needs that were present for our family, we moved.
okay.
And so I'm now in a place where I'm still in a role as a helper, but I'm in a larger community, and
Mhm.
so that tension is not there.
Mhm.
Um, I
Mhm.
think had I switched to a different profession and continued to live in a rural community, that would have eased some of that stress that
Mhm.
was really contributing to kind of that overwhelm for me.
Yeah.
Um, so those were the big things. Am I feel like also cultivating like hobbies. Like that sounds really cheesy, but
No.
yeah, but like giving myself kind of permission to do things that I love or to like try things and then not be good at them has
Mhm.
also been really helpful.
Mm.
Um so gardening, been building terrariums lately. Like I don't like just like something find for me like finding a creative outlet, like taking something and something about being creative and like taking things that are out of order and then creating order and structure, I feel like is so essential, even just in parenthood in general, right? Because
Oh, right.
like parenthood is loosely organized chaos so often. So
Right.
um
And sometimes not at all organized.
no,
Just straight up
no.
chaos.
Yeah. And then I'm trying to think what else has really contributed. I really am fortunate to have like a partner, a spouse who is very like compassionate and understanding, and who also was willing to communicate with me like this is not sustainable for us. Like
Mhm.
I can't be the partner that you need because I don't know how to do that, and also you're
Mhm.
not letting me. And so I think
Mhm.
being able to work through that was really helpful. I also was fortunate enough, like my parents lived in my hometown. And so I had this option of having childcare. And I also recognize that like my story for a rural community, like I lived in a rural community and worked at a hospital and had access to all of this knowledge.
Mhm.
And also I'm telling the story as like a cis hetero white woman in a rural community with who's highly educated. So I'm
Mhm.
for other listeners, like they might be 100 miles from the closest like hospital or hub of resources, or um, may not have the privilege that comes with um, being cis or being straight or being white
Mhm.
in the United States. And so I also recognize that there were a lot of things that I had even in my moments of suffering and struggle that were stepping stones that I could use.
Mhm.
Um, and so I think also really just making like radical acceptance, like just accepting like, oh, this is part of my story. Like like I'm someone who is going to probably need to tend to my mental health in some way, shape, or form for the duration of my life. And that's okay. Like that's
Right.
like
Yes.
I don't have to find like a definitive endpoint.
Yeah,
Like this is this is like managing a chronic health condition.
for sure.
And a lot of
It
people
is.
do that and live with that and
Yep.
it's fine. And sometimes it doesn't feel fine.
Mm.
But if I can like extend that kindness and grace to myself, then it's like that element of fighting and that element of impatience and
Mm.
like, I just have to get this sorted out is gone. And it just creates this level, I think, of ease that wasn't there before.
Right, for sure. I
Yeah.
love that perspective. Thank you for bringing it in. It is about managing it and not fighting it or beating it or being
Hmm.
done with it. And I mean, it's well, for a lot of people, it is about managing something long term, and for some people, it's not.
Hmm.
But still, I think even you might not know that it is or it isn't. And so having that perspective, that
Yeah.
kind of grace, I suppose, for
Yeah.
yourself, it just reduces the tension and the
Mhm.
negative energy around it. So
Yeah.
I think it's useful no matter what.
Yeah.
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 So and I think now I'm kind of my ongoing thing that I'm doing is I'm no longer working with the therapist who I was working with. Um, but I have been working quite a bit on cultivating like my own self-compassion practice. So I
Mm-hmm.
think a lot of people are familiar with like Kristen Neff and
Mm-hmm.
Chris Germer's work. And so that has just goodness, even if I wasn't living with kind of this anxiety, depression, and I was just like trying to navigate life in the current world, I
Right.
think that would be really,
Yeah,
really useful.
for
So,
sure. Well,
yeah.
I thank you so much for coming on and sharing your story, and within your story, kind of giving us these pearls and nuggets of understanding what it can be like in a rural community. And what I also appreciate is that you're really able to hold that this is your experience in this particular
Mhm.
rural community, and it might be different for other people, even in smaller communities. But I think. Um, Having, especially for the therapists who are listening, but also for the people who live in rural communities, to have this fuller understanding of why they might feel the way they feel is super
Yeah.
important. So, anyways,
Yeah.
thank you so much for coming on and sharing with us.
Yeah. Thank you so much for having me.
Thank you again, Hannah. In many ways, this podcast is aimed at people who don't have resources or don't know yet that they need resources. So, hopefully, if you know somebody who's in a rural community, this can serve as a resource or at least a guidepost for them to know that help is available, even if it's not directly in their community. They may be able to still find help and support online, especially these days when a lot of resources have moved to the online space. Even if you're not in a rural community, it can be hard to know that help is available. It can be hard to find it at times. So, as usual, share this episode with anyone who can benefit. Please do subscribe to the podcast. That's what gets us found and gets this resource to a lot of other people. Thank you so much for being with us. Until next time.